Boris Johnson will hold an emergency Cobra meeting today as Britain braces itself for the full force of the coronavirus outbreak.
Yeah, it comes after it was confirmed that a third patient in the UK has died after contracting the virus, with a total number of cases in Britain now standing at 273.
But with time running out to contain the virus, what's next? Here with an update on the situation, we're joined by Dr Sara.
And giving us her advice on keeping your home virus-free, Alice Beer is also here. Good morning to both of you. So, Sara, let's start off with you first of all. As predicted, the numbers are increasing. Is this something we should be becoming more concerned about?
I think because we've been expecting it, we've looked around the world, we can see that these numbers are going to increase. It's not something shocking, it's not something that we should be worrying more about, and it's exactly why the Cobra meeting is in place today, in order to make sure that if those numbers do continue to jump, that we have processes in step to delay.
Mm-hmm.
Did you ever think, as a doctor, did you ever think that we could contain it?
I think it was going to be unlikely we'd be able to contain it long term. I think people forget that actually the coronavirus is a long game. We've got to wait until the summer months, and even then it may not completely go away. We know that in China they've had the fewest numbers recently, so we know that over there it's starting to plateau. So hopefully it will plateau here at some point too.
Well, there are huge measures being taking place around the world, and I suppose really all eyes are on Italy because of the mass lockdown there.
Yeah. What's happening in Italy is, I understand, quite scary for a lot of people. We have to remember that even though we're close in terms of geographically, we have a very different healthcare system. They have a very different demographic of patient in northern Italy as well. They've got a higher elderly population. So we can't make direct comparisons of what's going on to what's happening here.
But of course, here is where we are, and so people are starting to think about looking after themselves. We've heard about sort of hand washing, and I think that's kind of beginning to sink in now. But what about attending sort of large public events? Should we sort of be self-quarantining ourselves, really?
I think you've got to be really sensible if you are elderly or if you have underlying health conditions. Potentially going to big, large events is not the right plan. If you're young, fit and healthy, I can't see why not at the moment. Having said that, that's why at the Cobra event today, they're going to be discussing whether they need to be doing any cancellation of any of the big events.
Right.
What about going abroad?
I think it really depends, again, on your own health situation, but also what the numbers are like in the destination venue you're going to. You know, avoid going to any of the places that you've been told are against the FCO's advice. Furthermore, you want to make sure that the place you go to has an excellent healthcare system should anything go wrong.
There's been a few complaints from doctors saying that they are ill-equipped if the worst should happen. And the NHS have just confirmed it will provide GP surgeries with personal protective equipment.
Yeah. So we've just, we only got an email today at my NHS practice to say that we'll be getting it at the end of the week.
And what is that?
Beginning of
Is that
next week.
masks?
So it's 400 aprons, 300 masks, 300 sets of gloves, which I'm hoping will be enough.
I was going to say, that doesn't sound like... If you're thinking every patient, you're going to have to change those
so
four. I mean,
exactly.
How many patients do you see in a day, in a week?
So bigger practices will be supplied within time more. But, yeah, you're absolutely right. I think we're a vulnerable group of people because we see so many sick, unwell people, and we're already a workforce that's quite low on the ground. So I think they really do need to protect the ones that they have. The plans, if we do go into the next phase, would maybe be getting some newly retired GPs back into the force, maybe even getting medical
themselves,
students.
because they're older, would be vulnerable?
Well, that's why I'm saying newly retired. So ones that have only recently kind of been outside of the workforce, but also ones that, yes, you've got to make sure that they're not particularly elderly. You also want to make sure that if they are the ones that are going to have to do it, they can do all the telephone triage and things like that.
And things like that, yeah.
We're actually changing the way we live, aren't we, now? Because we're shaking hands less. We're washing our hands ridiculously. I mean, you talk to people now and say, "Oh God, my hands are so chapped and sore because I've been washing them so much."
Yeah.
Kissing, greeting people. I mean, that's actually is this changing the way we live?
Yeah, our behaviour has changed, but I think it's necessary for this kind of this issue. I think environmental changes are all good and well, you know, cleaning things, but we have to also change our own behaviours.
Some of the behaviour we've seen recently is stockpiling, and it's not just things like toilet roll and food, but also certain drugs, things like ibuprofen, painkillers in shops, people calling in their prescriptions early to make sure they've got this. I mean, that's not helpful, is it?
This is so unhelpful. Firstly, because, as I said, it's a long game. This is months that we're going to be talking about coronavirus. This isn't just a this week issue, but also it affects the most vulnerable people, the elderly, the disabled, the people that can't traipse to 7 different stores to get the things that they need. I know a colleague's practice, his hand sanitizers were stolen from the clinic.
Oh, God.
And that's just ridiculous. That's meaning that one person is getting it when actually it could have been for 100 patients.
But the thing is that
That's
and
terrible,
it's human
isn't it?
nature, isn't it? It brings out the best in people and it brings out the worst in people. I mean, there are reported cases of small bottles of hand sanitizer being sold in newsagents for, you know, sort of 18 to 38 pounds.
In one of my practices, we were trying to buy some hand sanitizer and we couldn't access any for the clinic. They've all been sold out. So then we had to go onto eBay and, you know, Amazon and all these kind of various things, and they were being sold in the 90s.
No, it's madness. That is madness.
ridiculous.
OK, well, Alice, let's come to you now, because we're thinking about, you know, how to protect ourselves out of the home, but what about when it comes to in your home? Can you keep your house clean from coronavirus?
Absolutely. And that advice is so important to listen to. It's so calm and rational, and just that's what we need to bear in mind. Now, coronavirus isn't waiting in your home to leap out and get you. It's only in your home if you bring it into your home or a visitor brings it into their home, into your home. And obviously, it's coming in largely on your hands. So the first thing you do is obviously when you get into your home, you wash your hands, and that contamination throughout the house will be it will be eradicated mostly if that's what you're doing. But to clean your house is so easy and so quick and so cheap. You do not need to stockpile expensive products to do this. So there's 2 ways of getting rid of the virus. It would help if we knew, if the scientists agreed, how long it was on a surface for.
There's all sorts of variations.
Exactly. So it can live on a surface. Most of them agree that it will be at its most virulent for 2 hours. But the WHO, the World Health Organization, say up to 5 hours. Then a scientist in Southampton is saying up to 5 days. In America, disease control is saying up to 9 days it can live on a surface.
Right.
It's not helpful. So we need to keep our house clean. We need to keep our hands clean. Now, there's 2 ways of killing it on any surface, OK? You either wash it off. Now, washing it off means using any soap, liquid soap, to loosen the microbes on the surface and then rinse it until they're off. Obviously, you can't do that with your phone, your remote control, your computer keyboard, you know, your kitchen work surface. You can't rinse it properly. So the other thing you've got to do is kill it. There are 2 things that kill it. One is alcohol, which you can buy. That's your hand sanitizer. So 62% alcohol to 80% alcohol. And the second thing is bleach. Now, bleach will kill it. Obviously, you cannot wipe all surfaces in your home with bleach, but there are many around your kitchen that you can. Let's talk about the dilutions, because it's really important. This bottle of bleach, you fill up a capful of that, which is 15 millilitres, that's 3 teaspoons, and it will go in that amount of water. That's half a litre of water. And that, I would put it in a spray bottle like that, one of your old bottles. Put it in a spray bottle like that. Now, that bottle will give you 50 bottles, 50 bottles like that.
So just the capful, just one capful of that much water?
That bottle, diluted, will fill that 50 times.
And so, can I just ask then, if you're spraying that, I mean, bleach, we all know, takes the colour out of everything. So if you're going to be spraying that on your work surfaces, do you need to be careful not to get it on your clothes?
You need to be careful not to get it on your clothes, but you also need to be careful that when you've got it on cloths, you're washing them carefully. But there are lots of surfaces that you can use diluted bleach on, and it's not going to damage. But wooden or varnished surfaces, the alcohol as well, you don't want to use it on that.
I mean, I keep thinking, you wash your hands and you pick up the same phone afterwards.
You touch your phone 2,000 times a day.
So should we be washing our phone as much as we
You
wash
should be
our hands?
wiping your phone. Look at those lens cleaner wipes you have for your glasses and your screen cleaners. See if they've got alcohol in them, because a lot of them do. And that might be the thing to clean your screen with every now and then. But if you're touching this and you're not touching your face, it's not getting in, is it?
Yeah.
I mean, I'm a layman here.
Unless somebody sneezes on you.
Well, exactly.
Yes, of course, but you can't avoid that, whereas this you can.
You can avoid. So apparently we touch our face 2,300 times a day. And yesterday I was trying very
Not to.
carefully not to touch my face. It's amazing how many times you sort of want to do it. So if we just clean our hands, we clean our surfaces carefully, and please don't stockpile a bleach. Let's all get a little bit of bleach.
Bearing in mind you only need one bottle.
One bottle for 50 bottles.
And also, I would have thought your front door handle.
Front door handle, light switches, taps, all those switches around the house. It's, you know, you can do that. If you've got visitors coming in through your house and your children are coming home from school, I would just look at your surfaces and see if you can bleach or alcohol them. And if you can, then do.
Anyone who comes round to the house now, I'm putting them directly through a sheep dip.
Yeah, good idea.
Yeah. They all have to go through the dip.
Thank you both. Thank you.